See, yesterday we have seen the up to what? Up to where? Up to where? Up to cardinal signs. Yesterday we seen the cardinal signs. Now I will share you the screen. See that one. See, yesterday we seen the cardinal signs. Up to this one we completed. Okay. Recordings you will get all here. I won't repeat here. Okay. So today we will going to see the pathogenesis of inflammation. Genesis means what? It is the synthesis, but don't take here the word to word meanings. Okay. That is the inflammatory response. The pathogenesis means what? Gradual development of the disease. What is that one? Gradual development of the disease. Okay. The inflammatory response may be divided into two main stages. That is the vascular response stage and cellular response stage. What is the difference between the vascular and cellular? Vascular, that is seen, that response is seen by the naked eye, and this cellular response, that is that the response will not be seen by the naked eye. Now what is that one we will going to study? That one, vascular response means what? Rapid vasoconstriction of the blood vessels occur in the injured area and is followed by the rapid vasodilatation. Now see, listen carefully. Rapid vasoconstriction. Vasoconstriction means what? Narrowing of the blood vessel. Vasodilatation means what? Dilatation of the blood vessel. That is the enlargement, that is the increase the diameter of the blood vessel. Increase the diameter of the blood vessel. What happened here? The rapid vasoconstriction immediately followed by rapid vasodilatation, and due to that rapid action of two different things, that is the vasoconstriction, narrowing, and immediately followed by vasodilatation. So what happened? The fluid inside the capillary, it will rushes into the tissues, and that causes the swelling and edema. This causes the increase in the permeability, capillary permeability, and whatever the fluid is there in the capillary, this will enter into the tissue, and this leads to swelling and edema. The fluids that enter into the injured area are useful by diluting. For what purpose that fluid useful? This fluid dilutes the bacterial toxins and irritants present in the tissue. This fluid, it rushes into the tissues, and that causes what? That dilutes the bacterial toxins and irritants present in the tissue. Are you getting that one? Now we will see the cellular response. Phagocytic neutrophils. Neutrophils means what? These are the WBCs. These are the WBCs. Actually, these neutrophils are the major role in the phagocytic action. So the neutrophils arrive in the injured area first, and these neutrophils and other leukocytes are also attracted to the injured area by certain bacterial substances. Whatever the chemical agents are secreted by the bacteria, due to that chemical agents, these WBCs are attracted. These are attracted and gather into the injured area, and that substances we called as a chemotaxis, and that is called as a chemotaxis. See, these are also attracted by the cellular debris and cytokinins. Okay, this is called as a chemotaxis. These leukocytes are attracted to the injured area by certain bacterial substances, as well as by cellular debris, and cytokines. This is called as a chemotaxis. As the fluid leaves the capillaries, the viscosity of the blood increases obviously. Why? Because due to this fluid will get enter into the tissue, and due to that the blood will get viscous. And what happen? All the leukocytes precipitate to the walls of the capillary, and that process is called as margination, because they are precipitate in to the walls of the capillary. So this is called as a margination. Now leukocytes undergo, due to this process, the leukocytes undergo the change in the shape. They alters their shape due to that precipitation, and they will escape. They will come out from the blood vessels from the blood vessels into the tissues. Due to that change in the shape, these leukocytes escape from the blood capillaries and come into the tissues. The movement of the leukocytes through the capillary wall is called as a diapedesis. That is the emigration. Means from where to where it will come? Actually, they are in the blood capillaries, but they leaves that site and come into the tissues. This process, this migration is called as emigration. One place to another one. This is called as that process, that migration is called as emigration or diapedesis. The other WBCs such as eosinophil, basophils are also gathered into the injured area and releases the substances such as histamine, and that enhances the inflammatory reaction. This histamine, what is that histamine? Histamine is a powerful vasodilator that increases the capillary permeability. Why? Because it is a vasodilator. See again, due to that capillary permeability, what happens? Swelling and edema will take place. Okay, that swelling and edema we can see by the naked eye. But due to what the swelling and edema takes place? Due to secretion of the histamine. Because this histamine is a powerful vasodilator. Okay, so it causes the increase in the capillary permeability. Monocytes will also enter the inflamed tissues. Monocytes will also enter the inflamed tissues where the mature into the phagocytic macrophages. Okay, where they mature into the phagocytic macrophages. All these are giving the signals to the body if there is a inflammation in the body, and that's where the body will take, the human being, the individual will take care of that inflammation. These all are the what? Giving signals to the body. Now, these cytokinins such as the interleukin, tumor necrosis factor are released to enhance the inflammatory and the immune response. Prostaglandins are also Prostaglandins are also released by many cells in the injured area and causes the fever and vasodilatation. Prostaglandins, these are also giving signals. These are also gives the immune response, that is the signals or warning the human body. Okay, warning the body. Causes the fever and vasodilatation. Now we will going to see the types of inflammation. Two main types are there, acute and chronic. Acute means short term and chronic means long term. Okay, according to the duration, these types are acute and chronic. Onset of action in the see here, the onset. Acute inflammation, rapid onset of action takes place. Chronic inflammation, delayed onset of action. Okay, the onset is delayed. The onset is delayed. It will not get start immediately by attacking the causative agent. But here acute inflammation, whenever the causative agent attacks to the body, it shows the rapid onset of action. It shows the rapid response, but it is a delayed onset of action. It shows the delay onset. Okay, duration, short duration, it is long, that is weeks or months together. Specificity, non-specific, it is specific as it involves the acquired immunity. It is specific as it involves the acquired immunity, because the immunity will be acquired. Why acquired? Because due to that causative agent, our body will develop the antibodies. So acquired or develops the antibodies due to that the causative agent. So it is specific because it involves the acquired immunity. Okay, our body will develop the antibodies according to that causative agent. Now here the cardinal signs, 5 cardinal signs are here present. We can see in the acute inflammation, but in the chronic inflammation, no any type of signs and signs are there. No any cardinal signs we can see here. 5 cardinal signs like this calor, delor, tuber, tumor. Okay, so these cardinal signs are remain absent here. Causative agent, we discussed it before also, physical, chemical, tissue necrosis, immune response. Here the persistent infection. Here the causative agent, that is the infection, persistent infection, presence of foreign body, due to the presence of foreign body. And one more thing, that is the autoimmunity. That is the main thing, that is the autoimmunity. Means I will tell you one Marathi proverb that so that you can understand very well. कुंपणच शेत खातं, बरोबर आहे. That is the thing, means autoimmunity. Our immunity, our self immunity only, due to our self immunity, the antibodies will develop, and that will damages the normal healthy cells. That will damages the normal healthy cells, and that is bad. That is the worst thing. This is the autoimmunity, self immunity, body's self immunity, immune response. Okay, the fundamental cells which are involved here in the acute, neutrophil, macrophages, and here in the lymphocytes, T cells, B cells, macrophages, fibroblast. Okay, and seventh one, that is the fluid exudation and edema. Actually in the acute, everything is present. Fluid exudation is we can see, and edema is also there, but in this chronic it is absent. Fibrosis, that is the hardening of the tissue. Fibrosis, actually we call it as a fibrosis, means hardening of the tissue. It is absent here, but here it is in the chronic, it is present. And systemic manifestation, signs and symptoms, high grade fever is there, and other 5 cardinal signs are also present in the acute inflammation. But here in the chronic, only the low grade fever is there, loss of weight is there, loss of appetite is there. Loss of appetite means what? Loss of hunger. And due to that loss of hunger, here it is the loss of weight. Due to loss of appetite, bhuk na lagne, that is the loss of appetite. Okay, loss of appetite, due to that the loss of weight is there. Okay, loss of hunger. Okay. Peripheral changes, neutrophils, leukocytosis. That is the bacterial infection is there, and viral infection is also there. Here it is often absent and increase in the level of antibodies. That is the autoimmunity we discussed here. That is the increase the level of the antibodies. Okay. Due to that causative agent, our body will develop here the antibodies, and sometimes this due to that autoimmunity, it is the worst thing because it damages the normal healthy cells. Now, primary mediators, who are those one? The vasoactive amines, that is the serotonin, histamine, eicosanoids, that is the prostaglandin, thromboxane. Okay, and here in the interferon gamma, TNF alpha, okay, growth factor. You keep in your mind like that only. Don't go deep. Okay, hydrolyzing agent. Otherwise, it is the vast portion, but I make shortly how much possible, that much only you keep in your mind. I given in detail, not that much in detail, but little bit in detail. But then also, if you are not getting, leave about that one. In the next year, we will see in detail, okay, in the pharmacology. Now, pathogenesis, same I discussed before, that is the increased blood flow, transient vasoconstriction, and immediately followed by the vasodilatation. It causes the what swelling of the area. Okay, so transient vasoconstriction upon endothelial injury, and that is followed by release of cytokinins, and that promotes the vasodilatation, and that leads to warmness and redness of the injured area. What happens here? See once again, the increased blood flow, that increased blood flow means what? What happened here? Due to that action of that causative agent, what happened? Constriction, vasoconstriction upon endothelial injury, and that is followed by release of cytokinins. That releases, and this cytokinins also promotes the vasodilatation, and also this histamine also produces the vasodilatation. Okay, okay. So what happened here? Immediately it will produces what? Vasodilatation and leads to warmness. That is the calor, we call it as the heating. We feel some warm, isn't it? That area, little increase the temperature, that area, swollen area, okay, injured area, and it is redness of that injured area. Redness of that injured area. We see no before only, okay. So increase the capillary permeability, increase the volume of the blood that passes the capillary, increase the endothelial permeability, stasis of the blood leads to exudation. Chemotaxis means what? Movement of the neutrophils to the injured area. Due to what? Chemotaxis, that is the release of chemical agents of release of chemical agent by the bacteria, and that due to that chemical agent all the neutrophils will get attracted to that area, that is chemotaxis. Leukocytes recruitment and activation. Again, all the WBCs will gather there due to that chemotaxis. Okay. And here the infiltration of mononuclear phagocytic cells, that is the macrophages, circulates as the monocyte and reaches the site of injury within the 24 to 48 hours and transport. Here the T and B cells will become the plasma cells and produces the antibodies. Here they will produces actually the antibodies. And T cells will produce the cytokines to activate the B cells and also the macrophages. And again the tissue repair and angiogenesis. What do you mean by angiogenesis? That is the development of new blood vessels. Here, angiogenesis means what? Development of the new blood vessels at the injured areas. Tissue repairing. What happened here in the tissue repairing? Angiogenesis at the injured sites means development of the new blood vessels in that area. Formation of granulous fibrosis. Fibrosis means thickening of the tissue. Now we will going to see the treatment. Treatment, that is the anti-inflammatory drugs. Okay. Anti-inflammatory drugs means what? They reduce the inflammation and swelling. They reduce the inflammation and swelling. Anti-inflammatory drugs acts as a analgesic. Analgesic means what? Which relieves the pain. Which relieves the pain by reducing the inflammation. As it is opposed to the opiates, that is the different one. Analgesic, narcotic analgesics are there, non-narcotic analgesics are there. You will study in detail in the second year in the pharmacology. Okay, just keep in your mind that is the anti-inflammatory drugs like analgesics. They act as an analgesic. They relieve the pain by reducing the inflammation. Don't go for this one, opiates, that are the which affects the central nervous system. Okay, opiates are the it is acts on the directly into the CNS, and that area is there in the CNS, and that relieves the pain centrally. That relieves the pain centrally. Morphine is the best example. Okay, so we will study in detail in the pharmacology. Just you keep in your mind that is the anti-inflammatory agent that are acts as a analgesic. NSAIDs, that is the non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs. Keep in your mind that much only. They relieves the pain by contracting the cyclooxygenase COX enzyme. That is the concentrating the cyclooxygenase, that is the COX enzymes. Okay, that is the in detail study. Just you keep in your mind the best example, that is the examples of NSAID, that is the diclofenac, mefenamic acid, ibuprofen, naproxen, some of the example you keep in your mind. This is all about the inflammation. Okay, this is all about the inflammations. Here I will give you again. I will stop the sharing. I will give you these recordings, everything. Okay, I will stop here only.